start discussing general factors. So what are general factors which can affect wound healing? These are 8. So 8 fast in young adults. So 8. First general factor is age, then nutrition, uh, then hormones. So first we will start about age. So age, wound healing is fast in young and normal in old age unless associated with debilitating diseases or ischemia or diabetes. So uh, if it is normal in old age, but if there is no diabetes or any other debilitating diseases, then it is normal. But if there is diabetes, then there will be delay of the wound healing. Now nutrition. So nutritional deficiency or any mineral deficiency can delay wound healing. So first we will discuss about protein deficiency. So protein deficiency, protein plays important role in collagen synthesis. So if there is uh, deficiency of protein, then there will be delay in wound healing. So protein depletion, impairment of granulation tissue and collagen formation. So there will be impairment of granulation tissue and collagen formation, not always due to inadequate intake. So causes for protein deficiency are inadequate intake and excessive loss. So not always due to inadequate intake, but maybe due to excessive loss. Example, nephrotic syndrome, cirrhosis, chronic inflammatory conditions. Next cause is next nutritional deficiency is vitamin deficiency. So vitamin C plays important role in wound healing. So it helps in collagen synthesis. So if there is deficiency of vitamin C, then there will be defect in collagen formation. So that's why there is delayed wound healing. Then vitamin A deficiency. So required for proper epithelialization. Vitamin A is required for proper epithelialization. Then zinc, calcium, copper and manganese deficiency. So these nutrients also play important role in wound healing. So if there is deficiency of wound, then there will be defective protein synthesis and there is failure of granulation tissue formation. So as there is failure of granulation tissue formation, there will be impaired wound healing. Now next factor is hormones. So what are hormones? Next factor is hormones. So hormones are, which hormones can affect wound healing? So corticosteroids. Cortisone and its derivative decrease the rate of protein synthesis. So they will decrease the rate of protein synthesis. Also stabilize liposomal membranes and inhibit normal inhibitory reaction. So as they are inhibiting normal inhibitory reaction, normal inflammatory reaction. So we know that phase of inflammation is the first step of wound healing. So if they are affecting that, then there will be impaired wound healing. Also they will decrease protein synthesis and we need protein for collagen synthesis. So if there is protein synthesis, then there will be impaired wound healing. High doses of corticosteroids limit capillary budding, inhibit fibroblast proliferation and decrease rate of epithelialization. Now next hormone is decortisone acetate and anabolic steroids. So decortisol acetate and anabolic steroids, like testosterone, are also concerned with increased speed of wound healing. So they will increase the speed of wound healing, that is corticosterone and anabolic steroids will increase the wound healing. Then cytotoxic drugs and radiation. Most of the cytotoxic agents show their greatest effects on dividing cells. So they have greatest effect on dividing cells. 5-fluorouracil chronic, if we apply 5-fluorouracil chronically, then it will inhibit or delay wound healing. Then high doses of radiation, especially during first 3 days, will delay the strength of wound significantly. Then following condition will delay or hamper the wound healing. So that is anemia, uremia, jaundice, diabetes, blood disorders, malignant diseases, and cytotoxic drugs. So these are the systemic factors. Now we will move on to the local factors. So now we will discuss about the local factors. So what are the local factors which can affect wound healing? So local factors. So position of the skin wound. So site of the wound is very important. When skin wounds are parallel to the line of the Langer, they heal faster. So if skin wounds are parallel to the line of the Langer, they will heal faster. But if they are perpendicular to the line of the Langer, there will be delayed wound healing. Then second factor is blood supply. So poor blood supply, slow healing. Increased blood supply, faster healing. Now tension. So wound in tension, healing will be jeopardized. So hematoma and infection increase the tension. So if there is increased tension, then there will be delayed healing. Now infection. Once infection occur in the wound, healing is always delayed. So this is very important point. Note down this point, that is, where once infection occur in the wound, healing is always delayed. And this is very important point, that is, this is most important factor that delay the wound healing. So this is important question, that is most important factor which delay the wound healing is infection. Most important factor, infection. So fibroblast. So why infection delays the wound healing? So reason is fibroblasts face tough time to persist as they have to compete with inflammatory cells and bacteria for oxygen and nutrients. So we know that in the if there is infection, there will be bacteria, inflammatory cells. So fibroblast will compete for nutrient and oxygen from with the bacteria and inflammatory cells. So there will be delayed wound healing. So therefore proper granulation tissue formation and collagen formation will be affected. Now next point, this has been often the cause of the burst wound which requires secondary sutures. Now the next important point is movement. So movement will delay the wound healing. So rest is essential. The delicate capillary loops of granulation tissue and delicate epithelium are damaged due to wound healing. As there is damage to the delicate capillary and delicate epithelium, so there will be defect in the clot formation, there will be defect in the granulation tissue formation. That's why there will be delayed wound healing. Frequent change of dressing, avoid. So we have to avoid frequent change of dressing because this will delay wound healing. And movement will facilitate the entry of bacteria that will infect the wound. So that's why we don't want any infection in that wound. So we have to keep our wound sterile, because once infection occurs, there will be always delay in the wound healing. So note down that point. Now exposure to ionizing radiation inhibits wound healing. Then foreign bodies will also inhibit wound healing. Adhesion to the bony surfaces will impair wound healing. Necrosis and lymph drainage. So these are few important points which can delay wound healing. So these are the local factors, and other factors are UV light and faulty technique of wound closure. So if wound closure is not proper and doctors have not closed wound properly, then there will be delayed wound healing. So these are the local factors and general factors which can affect wound healing. We will revise it again. So first, local factors are infection, presence of necrotic tissue or foreign body, poor blood supply, venous or lymphostasis, tissue tension, hematoma, large defect or poor apposition, recurrent trauma, X-ray irradiated area, site of the wound. Then general factors: age, nutritional deficiency, vitamin C, protein deficiency, vitamin A, anemia, malignancy, uremia, jaundice, immunocompromised patients, HIV, diabetes. Then certain drugs can also impair wound healing.